All right, everyone. Thank you so much for joining. My name is Caitlin Shelton, and I am the Special Assistant to the Center for Faith and Opportunity Initiatives here at HHS, or what we like to call for short, the Partnership Center. We're delighted that you've joined us today for the second installment of our new webinar series on family health. Today's webinar focuses on vaccines, their safety and efficacy, and how the faith and community-based organizations can promote them in their communities. As you may know, this webinar comes in the midst of a global measles outbreak, one that has affected more than 1,000 Americans in 2019 alone. Despite this, many still have questions about vaccine safety, especially for their children. As kids head back to school this fall, we're excited to learn more about vaccines from Drs. Amanda Cohn and Tammy Beckham. I'll hand it off to our speakers in a moment, but first, a few housekeeping notes before we begin. This is an educational webinar, off the record, and not intended for press purposes. If you are a member of the press, we will be happy to connect you to the press office here at HHS after the program. Please email partnerships@hhs.gov if you wish to be connected. If you're having difficulty hearing us clearly, you may find it helpful to call in to the number on your screen rather than listening through your computer. We've found that sometimes works better for sound quality. Also, please use the chat feature to let us know of any challenges you experience, and we'll do our best to address those as we adjust to this new platform for our office. Be on the lookout for a follow-up email in the next day or two. We'll be sending a link to a recording of today's webinar, along with several resources, including a copy of each slide deck. If you have questions, you can email us at partnerships@hhs.gov. We do plan to have a question and answer session at the end, so please make comments and share your thoughts in the question box, also seen on the right-hand side of your screen. If you'd like to go ahead and use that question box to share the city or state you're listening from, we'd love to see it. Finally, let me introduce our director, Shannon Royce, to welcome our special guest.
Thank you, Caitlin. I appreciate your leadership on this important webinar. I'm so pleased to welcome my friend and colleague, Dr. Robert Redfield. Dr. Redfield is the 18th Director of the Centers for Disease Control and Prevention and Administrator of the Agency for Toxic Substances and Disease Registry. He's been actively engaged in clinical research and care of chronic human viral infections and infectious diseases, especially HIV, for over 30 years. Dr. Redfield served as the founding director of the Department of Retroviral Research within the U.S. military's HIV research program, co-founded the University of Maryland's Institute of Human Virology, and served as the chief of infectious diseases and vice chair of medicine at the University of Maryland School of Medicine. He served as a member of the President's Advisory Council on HIV/AIDS from 2005 to 2009, and as chair of the International Subcommittee from 2006 to 2009. Dr. Redfield has contributed to HIV/AIDS research and treatment around the world. Dr. Redfield, we look forward to hearing from you. Thank you for joining us.
Thank you very much, Shannon. Good afternoon, everyone. Are we live? I don't see it.
You want to show the video, Shannon?
You're live. We can see you and hear you, Dr. Redfield.
Oh, great. Good afternoon. Thank you for allowing me to join you today to talk about one of the public health's greatest achievements, vaccines. As the summer vacation ends and it's time to return to school, it's important to remember all the different ways we can prepare our children for a successful school year. One of the most important things to check off the list is to make sure your children and your young teens have received age-appropriate vaccination of all the recommended vaccines. Vaccines are the most important and powerful tool we have to prevent and to eliminate many infectious diseases. It's important to recognize vaccines are safe. Vaccines do not cause autism. Vaccines do prevent serious disease. When I was growing up, we lived in fear of polio. Our children and grandchildren, they don't understand the polio fear today because it's been eliminated. Many older adults experienced measles firsthand. as children and develop natural immunity. Unfortunately, younger generations, including even today's parents, have never seen these diseases and don't understand the serious health threat that they present. Diseases like polio, diphtheria, measles, and pertussis could return if children, and adults for that matter, remain unvaccinated. In fact, measles was eradicated in 2000 in the United States, yet today we have reported cases in more than 30 states. These cases resulted largely from Americans traveling abroad and then returning to communities with low vaccine rates. As the children return to school, we need to ensure that they've received key vaccines for the highly contagious diseases like measles, so measles doesn't regain a foothold in our nation. I need you to help the public health officials get the word out that the measles vaccine is safe and it's effective. And as I said, it does not cause autism. Most parents choose to ensure that their children are vaccinated. However, some parents are reluctant because of concern of making a mistake. Others are misinformed. We're hoping that parents will do the right thing and make sure that for the health of the children, they do get vaccinated. Talk to your healthcare providers that you trust and find out the best ways to vaccinate you and your family. If we had a vaccine for cancer, I asked people, who would not want to receive it? But in reality, we do. The human papilloma vaccine. Human papillomavirus causes cervical cancer and precancerous lesions. It also causes other cancers in both men and women. HPV vaccine now has been given over 100 million doses. And again, it's safe, it's effective, and it's long-lasting. CDC guidelines recommend both adolescent boys and girls get vaccinated against HPV. This vaccine can protect women from cervical cancer and both men and women from other forms of cancer. Vaccines also remain a powerful tool that we have to protect ourselves against the greatest health threat that we have worldwide, and that is flu. If you should get flu vaccine, the flu season's coming up, there are really a number of reasons. First, it could save your child's life. A recent study showed that flu vaccine significantly reduced the mortality among children dying from influenza. Even if you do get flu, if you have been vaccinated, a flu vaccine will most likely reduce the severity of the illness. And finally, if you get vaccinated in your family, you have a major impact on potentially reducing the transmission to other members of your family and those individuals in your community, including those that may not be able to be vaccinated themselves. Polio, as I mentioned when I started, when I grew up, it was a disease that was a great deal of fear about polio. And yet now that's been eliminated in the United States in 1979. It's hard to believe, but global efforts today have eliminated polio now, almost 99% of polio worldwide. We're very close to eliminating polio, and we have 3 countries right now that have not been declared polio-free at the present time. But very soon, polio will become eliminated worldwide, and for one reason, because of the embracement of the polio vaccine globally. Finally, I want to just emphasize that vaccines are the most powerful gift of science that we have to modern medicine. And science that sits on the shelf has absolutely no value. I remind everyone that science is a gift from God, and we should put it to use. So I thank you for the opportunity to talk to you. I hope you listen and have a good workshop with the other speakers. But just remember what I started with, that vaccination is the most powerful tool we have to eliminate disease. and it's the only tool we have in modern medicine to eradicate disease. Let's not leave it on the shelf.
Thank you so much, Dr. Redfield. And just as a reminder to everyone who had trouble seeing the slides, we will be sending a link to all attendees after the presentation so that you will have access to that slide deck. We appreciate your being with us today, Dr. Redfield, and I'm now excited to introduce to you our two presenters, Dr. Amanda Cohn and Dr. Tammy Beckham. Dr. Amanda Cohn currently serves as the Executive Secretariat of the Advisory Committee on Immunization Practices and Acting Chief Medical Officer for the National Center for Immunization and Respiratory Diseases. She previously served as the Deputy Director of NCIRD's Immunization Services Division. And we are getting some feedback, so if we could have all presenters make sure that they're muted. Thank you so much. Dr. Cohn came to the CDC in 2004, where she focused on prevention and control of the meningococcal disease, both domestically and internationally. She is board certified in pediatrics and is a fellow of the American Academy of Pediatrics. Thank you for joining us, Dr. Cohn. And our next presenter is Dr. Tammy Beckham. Dr. Tammy Beckham is the Director of the Office of Infectious Disease and HIV/AIDS Policy at the Department of Health and Human Services. In addition to this role, Dr. Beckham is also providing operational direction and oversight for the President's Ending the HIV Epidemic Initiative, a Plan for America. She also oversees the execution of national strategies for HIV, viral hepatitis, sexually transmitted diseases, and vaccines in response to the highest priorities of the Secretary and Assistant Secretary for Health. Dr. Beckham received her Doctor of Veterinary Medicine and PhD in Biomedical Science degrees from the Auburn University. She holds a master's degree in music from the University of Cincinnati. Thank you so much for being with us today, and I'll now turn it over to Dr. Cohn. And Dr. Cohn, make sure that you are unmuted, please. Dr. Cohn, I believe you are still.
Yes. Yeah, can you hear me now? I'm so
yes,
sorry.
We hear you now. Thank you so much.
And can you hear my slides? Can you see my slides?
Yes, we can see them. You're good to go.
Okay, everyone, I apologize for that. Thank you so much for having me here this afternoon. I am honored and excited to share with you information and facts about childhood vaccines. So there are 6 reasons to keep children vaccinated according to the recommended immunization schedule. And this is sort of to set the stage for the rest of the talk and to really understand why the childhood immunization schedule is set up the way it is. So the first is, this is the ideal timing for kids to get their vaccines. The immunization schedule is carefully designed to provide protection at just the right time. We give infants and children vaccines before they're at greatest risk for exposure to the diseases, so they're already protected when they get exposed and potentially when they could have the worst complications from developing childhood vaccine-preventable diseases. We also give young children and babies vaccines to prevent complications. While babies are born with some immunity, they haven't built up the necessary defenses against the diseases that vaccines prevent. So we're really giving these vaccines early in childhood and infancy to provide that boost in immunity when they're as young as possible. It can take weeks for a vaccine to help your baby make protective disease-fighting antibodies, and some vaccines require multiple doses to provide the best protection. Children won't have the best protection from 14 serious diseases until they get all of the recommended doses of each vaccine. And while breastfeeding provides important protection from some infections as your baby's immune system is developing, breast milk does not protect children against all diseases. And finally, not vaccinating your child on time can make someone else sick. So following CDC's immunization schedule helps protect children against 16 serious diseases. And some of these diseases Dr. Redfield just previously talked about used to cause substantial morbidity and mortality in the United States. We used to have hundreds of thousands of cases of measles every year, pertussis, polio, and many, many deaths from these diseases. There's a list of the diseases that are prevented on the side, and then in the adolescent years, you're protected against 2 additional diseases, HPV, which Dr. Beckham will talk about in a few minutes, as well as meningococcal disease, which can cause very serious meningitis and death in up to 10% of patients. I want to remind you that there are some easy ways to keep track of the vaccines for a parent. Parents can request a vaccine record from their child's doctor, which can serve as official proof of vaccination for child care programs or schools. Parents should keep the vaccine record in a safe place. And there's also a CDC resource, which is called a vaccine tracker, which parents can use for their own personal records. We want to encourage parents to use the tracker to see if their children are up to date and make sure that parents understand the vaccines that are recommended as their kids get older. We also have almost every state in the U.S. has an immunization information system or immunization registry, which is a computerized database that doctors put all immunization records into. And so in many states, child care providers can access the immunization registry to understand how many vaccines a child's gotten. This helps prevent children from getting more vaccines than they need, and also helps doctors make sure that the kids are getting all the vaccines that they need, especially when a child gets behind on vaccines. So you can ask your doctor for the children's immunization information record from the immunization registry. So vaccines are studied extensively before, during, and after we make recommendations for vaccines. The U.S. vaccine supply is the safest in the history of vaccines. While we actually are protecting children from more diseases than ever before, there's actually far fewer different antigens and ingredients than were in previous vaccines that we received when we were growing up. So vaccines are incredibly safe. Before a new vaccine is given to people, it goes through years of lab and clinical testing. And once a vaccine is licensed by the Food and Drug Administration, there's a committee of experts that evaluate all aspects of the vaccine before considering to add it to the recommended immunization schedule. This committee is called the Advisory Committee for Immunization Practices. We never stop monitoring the safety and effectiveness of the vaccine. So there's a strong system in place to help scientists monitor vaccine safety that is always ongoing. There's several systems that we use. There's systems that, just so you can hear the name of them, there's 3 systems that sort of provide broad surveillance for vaccine adverse events. One is called VAERS, the other is called the Vaccine Safety Data Link, and the other called the Clinical Immunization Assessment, or CISA. These systems complement each other and help us monitor the safety of vaccines and make sure that we're constantly conducting vaccine research, and we're quickly able to detect any sort of safety signal, which has happened in the past, and pulled those vaccines from market very rapidly. I want to focus today on, for a few minutes, on measles. So measles is a respiratory disease caused by a virus. It can cause very high fever, cough, runny nose, red and watery eyes, and tiny spots inside the mouth. Measles is one of the most contagious diseases. It spreads when people cough or sneeze, and people who are infected can spread measles 4 days before they get the rash, through 4 days after it appears. And just to give some perspective, if you're in a room full of 100 people who have not gotten the measles vaccine and are not protected against measles, and somebody with measles walks through that room, 90 people out of those 100 will develop measles from that very small exposure. You don't have to touch anybody. You don't have to talk to anybody. It is an incredibly contagious disease. And we still have millions of cases of measles each year, and thousands of deaths. Measles is most serious in children under 5 years old and adults over 20 years of age. And so I know a lot of you may have said, well, I knew people with measles growing up and everyone got better. And it can feel that way because most people do get better from measles, but around 1 in 5 people who get measles get hospitalized. 1 in 20 people can get pneumonia, which is the most common cause of death for measles in young children. And 1 out of every 1,000 people who get measles will develop encephalitis and leave the child potentially deaf or with intellectual disability. And we know that 1 to 3 of every 1,000 children who get infected with measles will die from respiratory and neurologic complications. So we're really lucky in the United States. We've had over 1,000 cases. In the U.S. this year, we have not had any deaths, thank goodness. We have had several very serious cases, and many children have been in the intensive care unit, and several adults as well have developed very serious disease. But fortunately, up to this point, they have all recovered. Measles may cause pregnant women who have not had the MMR vaccine to give birth prematurely or have low birth weight babies. So measles is also it's really important to protect pregnant women from measles as well. And you can't get the measles vaccine once you're pregnant. So an important thing to understand about measles is that it's increased 300% globally in 2019. We're in a year of worldwide measles outbreaks. And this map shows you all of the countries that are currently experiencing high rates of measles. And really the most important thing to understand about this map is measles is everywhere. And the reason why that's important for us in the United States is because all of our measles cases have been imported from other countries originally. And what happens is when a case is imported from another country, so when an unvaccinated person travels abroad and comes back, they can then spread measles into under-vaccinated communities. And so for people who are traveling internationally for any reason, getting up to date on their measles vaccine and checking their measles immunity is really critical before they travel. And you can just, if you're not sure that you've gotten the vaccine prior to international travel, you can always get another dose. Your doctor could also check immunity. But this is the way to prevent measles from spreading in the United States. And it's really important for people to understand that really any country they travel to at this point, they're at risk for measles and then bringing it back into the United States. We have had several very long outbreaks of measles in the United States this year. Those outbreaks have been started by imported cases, but then those individuals have come back into under-vaccinated communities, and it's really measles has spread like wildfire. So it's like the Kindle that causes measles to spread in under-vaccinated communities. So who should be vaccinated? Children get their first dose of measles vaccine at 12 through 15 months of age, and their second dose at 4 to 6 years of age. 2 doses of MMR vaccine are highly effective, are 97% effective at protecting against measles. This is one of the most effective vaccines we have. MMR vaccine protects you and people who are unable to be vaccinated because they're too young or have weakened immune systems. So the most important thing to understand about measles is that infants less than 1 year are too young to get vaccinated. The vaccine doesn't work as well in kids that are younger than a year of life, but those are actually the kids who are at the most risk for having serious complications from measles. So it's important to protect your child from measles, but also to protect the children in the community that are too young to get vaccinated, or children who have immunodeficiencies and adults who have immunodeficiencies and can become very, very sick from measles. I'm going to shift a minute to another really important vaccine we hope you can spread the word about getting, and that's the influenza vaccine. So the annual influenza vaccine is the single best way to protect yourself and loved ones from the flu. And I know influenza vaccine is not as nearly as effective as the measles vaccine, but given how many cases we have in the United States every year, and how widespread flu is every year in the United States, it actually prevents an incredible amount of disease, even without being as effective as some of our other vaccines. The flu vaccine can save children's lives. It can also reduce the risk of hospitalizations and reduce the length of illness. So many times you may actually, and this past year I had received the influenza vaccine. I had the flu, but I had much less severe illness than I might have had I not gotten vaccinated, and I was better very quickly. So talk to your healthcare provider about which vaccine to get you and your family. And we really recommend getting vaccinated before influenza season starts. We can never predict the exact timing of influenza season, and we can never predict how widespread or how serious each influenza season will be. And so what we do know is that vaccines are one of the best things we can do to protect ourselves and our families from influenza. It's also really important for people to understand that we have an amazing program called the Vaccines for Children program. This is a federal program that provides vaccines at no cost for children 18 years and younger. So any parent who is seeking a vaccine should be able to get vaccinated, and if they can't afford it, we want to reduce those barriers to vaccines. And so the Vaccines for Children program covers children who are Medicaid eligible, uninsured, American Indian or Alaska Native, or underinsured, which means that their insurance may not cover vaccines or certain vaccines. This covers vaccines free of charge, and we have over 44,000 providers in the United States who provide Vaccines for Children vaccines. And so this is really an amazing resource, and parents should never fear that they can't afford to vaccinate their child. They can find a way to get vaccines through this program, and we really want to spread the word about this program. So I'm going to talk in a few minutes about some of the myths around vaccines and try to help resolve those myths with facts. And I want to start this discussion by saying that we know that every parent wants to make the best health decision for their child. And there is a lot of information out there that is really hard to sift through. Additionally, we know that many young parents have not seen the devastating effects of vaccine-preventable diseases. So when I'm talking to an audience of older adults who still remember these diseases, it is a very different perspective than young parents who really have no memory or knowledge of how serious these diseases are and feel like they're in the past. So it's really important that we provide clear and accurate information about the safetyness and effectiveness of vaccines. And I think this is the best way, and you guys helping to spread these messages is the best way that we can reach parents and families who do have questions about vaccines. And we all have questions about every health decision we make about our child. And it's become really clear to me that people trust those in their community. They trust the people around them, and they trust the messages from people in their community and social space. And so as partners, we really want to make sure you have the information that y'all need to share with your communities to help parents understand how important and safe vaccines are. This bar chart at the bottom shows the state, what I like to call the state of vaccines, of how parents feel about vaccines. And there are not numbers attached to this, but what I really want to remind people of is, yes, most parents do not have concerns about vaccines, but there is a large group of parents that have questions, but still are planning on vaccinating their child, but really need access to information and the right information so that they can make the best healthcare decision for their child. There will always be some parents who do not want to vaccinate their child, and that is completely the decision of that parent. There are obviously school vaccination laws in place, and different states have different laws, but the group of parents that we really want to reach are these parents with questions, and we want to reach those parents with the right information and make sure that their questions are being listened to and answered. And so I'm going to talk about a couple of those questions that we do get. So vaccines do not cause autism, and I know Dr. Redfield said that previously, but I want to reiterate that multiple exhaustive, reputable scientific studies have found no link between the MMR vaccine and autism. Signs of autism after receiving a vaccine does not mean that the vaccines caused the onset of autism. MMR vaccine has a long safety record, and serious adverse reactions from MMR vaccine are rare. And I know, you hear stories of individuals who believe that vaccines did cause their child's autism, and I understand that those stories can be powerful and hard to, we want parents to have more information about the causes of autism, and it's really important for us to do more research and understand what we can do to reduce the risk of autism, but we are very confident that MMR vaccine is not connected to autism. We also want to clarify that vaccines do not overwhelm a child's immune system. On-time vaccination throughout childhood helps provide immunity before children are exposed to life-threatening diseases. And vaccines are routinely tested with multiple vaccines given at the same time to ensure that they're safe and effective. When a new vaccine is added to the schedule, they've done studies where they've not only tested that vaccine given alone, but given that vaccine with every other child that a child would be getting at that age. Your child is exposed to thousands of germs every day in their environment. This happens in every way, shape, and form. Everything your child puts in the mouth, things the child eats, we are exposed to all sorts of antigens every day. And the antigens in vaccines help build a child's immune system. They don't overwhelm a child's immune system. Vaccines do not contain toxins. Only some flu vaccines and multi-dose vials, and no recommended childhood vaccines contain thimerosal as a preservative. There has never been thimerosal in the MMR vaccine, and vaccine ingredients play an important role in making the vaccine or ensuring its safety and effectiveness. So the ingredients in that, and every ingredient that's put into a vaccine is critical to help the vaccine work the way it's supposed to. And these are ingredients that we see in many, many other places, in many foods and in the environment and in breast milk and in our medications that we give children. And these are very tiny amounts. But the important thing to understand is that thimerosal is not in any vaccine, and there's no mercury in any childhood vaccine. And it's only in the flu multi-dose vials that are rarely used in pediatric clinics. And I want to end by strongly recommending our website, www.cdc.gov/vaccines/parents. This is where we want parents to get timely, credible immunization information. This has easy-to-read immunization schedules, basic information about vaccine-preventable diseases, information about each kind of visit, information about how to help a parent keep their child calm during vaccines, how to reduce the pain. Also talks about records and requirements, and has several really great videos that help explain how vaccines work. And I just want to end by saying that, you know, I know we all want children to thrive, and this is the age in which keeping them healthy is the most important thing we can do so they can get to school, so they can stay healthy and really do all they're meant to do in this world. So thank you very much for having me.
Wonderful. Thank you so much, Dr. Cohn. And now we will have Dr. Beckham. All right, Dr. Beckham, we saw your slides, but now we are not seeing them anymore.
Okay, can you hear me?
Yes, I can hear you.
Great. I'm getting ready to share, I think. Okay, are we good
Perfect.
now? Can you see the slide? Great. Okay, so thank you
That's
so
good.
much for having me this afternoon. Really appreciate the opportunity to be here and talk about the HPV vaccine with the group. And I also want to say thank you to Dr. Cohn and Dr. Redfield as well for all of the comments they made in their presentations. So this afternoon I'm going to talk about human papillomavirus vaccine, talk a little bit about national rates, the importance of vaccinating, some of the challenges around vaccination. I'll talk a little bit about safety and efficacy as well, and then some tools for you to use in your communities and opportunities for you to help be the advocate and increase vaccination rates within your community. So as mentioned previously by Dr. Redfield, and I'm just going to briefly touch on this, but in 2019, WHO labeled vaccine hesitancy as a top 10 threat to global health. And Per WHO, vaccine hesitancy threatens to reverse progress that we've made in tackling vaccine-preventable diseases. And one example of this, as just mentioned and talked about with Dr. Cohn, is the surge in the measles rate globally, 300% the last year. And so, as Dr. Redfield so eloquently stated, vaccination is one of the most effective and cost-effective ways to avoid vaccine-preventable diseases. And we know that vaccination prevents 2 to 3 million deaths per year. And as he said, it's the most powerful gift of science to modern medicine. And we should not leave it on the shelf, but definitely use that. So in light of some of the challenges that we've had this year and some of the things that were just discussed around vaccine hesitancy, et cetera, the leaders in HHS, and to include the Secretary and President Trump, have all been advocates and made statements over the last several months about vaccines, their safety and efficacy. And in fact, Admiral Giroir, who's the Assistant Secretary for Health, and Dr. Redfield and Surgeon General Jerome Adams all penned a New York Times op-ed on the truth about vaccines, just to point out that we're starting to see diseases that should be in our history books, and they're showing up in our emergency rooms, and wanted to get out the truth about vaccines and their safety. So having said those things and kind of reiterating what's been talked about in the previous two talks, I want to move on to HPV and HPV vaccination. So as I mentioned, moving on, HPV infections result in substantial burden of disease on a global level, and this substantial level includes cervical cancer, anal genital malignancies, oropharyngeal malignancies, et cetera. And in fact, HPV vaccinations are known to cause 6 types of cancer. HPV infections. HPV vaccination can prevent more than 30,000 cases of HPV cancers each year in the United States, including almost all cases of cervical cancer. Going to the next slide, you can see that there are 6 types of cancer that are on this slide that are HPV attributable cancers. And the blue shows sites where HPV is often found, and in the orange you see the numbers that are likely caused by any HPV type as well. So we have cervical, vaginal, vulvar, penile, anal, and oropharyngeal cancers here. So despite the causal relationship between HPV infections and the associated 6 cancers that I just mentioned, we know that nationally our HPV vaccination rates remain low, and that as of 2017, only 49% of adolescents are up to date on the series vaccination. HPV vaccination is cancer prevention, and Dr. Redfield mentioned that earlier as well. If you had a cure for cancer, wouldn't you be ready to use that? And in fact, HPV vaccine should be given to both boys and girls at ages 11 and 12. And we know that HPV infection and HPV is so common that virtually everyone will come into contact with HPV at some point in their lives. Roughly 80% of people during their lives will come in contact with HPV. As I mentioned, the HPV vaccine is a series of 2 shots given 6 to 12 months apart for children ages 11 and 12, and the series should be completed at age 13. And then after age 13, you need to talk to your doctor about vaccination as well. As I said, HPV is an urgent public health issue. And if you look at this slide, you can see the lighter colors of green show lower coverage rates of HPV vaccination. And so the lighter the green, the lower the coverage, and the darker the green, the higher the coverage. Some of the contributing factors to low HPV coverage include providers not giving strong enough recommendations for HPV vaccine when compared to other vaccines. And so we do know that the single most important deciding factor for HPV vaccination is a provider's recommendation. And it's important for providers to realize that they can bundle the HPV vaccination when they're talking to their patients and parents with the other vaccinations that are given at the same time. So do it on the same day in the same way as you do the other vaccinations that are given at the same time. We also know that there are missed opportunities with regards to giving the HPV vaccination, and there's a real need to reduce those missed opportunities within the doctor's office and provide this as preventative care. And then we also know that we are seeing some rule challenges around HPV vaccination coverage as well. So moving to the next slide, pointing out some of the disparities in the rural vaccination rates of HPV. Typically, adolescents living in rural communities have received the first dose of HPV vaccine series remains 11% lower than those who live in the urban areas. And again, it's similar to the previous slide. If you look at the lighter colors, you can see the lower coverage rates as opposed to the darker blue or even purple, which you see the higher rates. And some of the contributing factors to the lower coverage rates in rural areas include shortages of primary care physicians and pediatricians, less access to supply or vaccination sites, and less community-based vaccine immunization education for providers. And so these are some of the challenges that we're facing with rural vaccination. And so you and your community, again, can help by getting the word out about the safety and effectiveness of this vaccine and the fact that HPV vaccination is, in fact, cancer prevention. Also, on the previous slide, I showed just briefly that one of the challenges was also vaccine mandates within different states. And on this slide, I just really want to point out that there are 2 states in DC that have mandates for HPV vaccination. And as such, Rhode Island has the highest coverage rate in the nation for completion of the HPV vaccination series, and that was in 2017. So I want to spend a couple of minutes just talking about vaccine safety. And, you know, as Dr. Cohn mentioned, we have the safest vaccine system in the world, and that our vaccines are studied very extensively prior to being approved and recommended by the ACIP, and also after they are approved and recommended by ACIP. So they go through extensive clinical and lab testing, as mentioned, and as well after they are approved and recommended and licensed. There are different mechanisms, as she mentioned, the VAERS, the Vaccine Safety Data Link as well, to continually monitor the safety of vaccines. And so HPV has been out since 2006. So literally we could vaccinate the HPV vaccine because it's time. What I mean by that is it's old enough itself to be vaccinated. And we have over a decade of data on the safety and efficacy of the HPV vaccine. And as Dr. Redfield already mentioned, over 100 million doses have been given in the US and over 270 million doses worldwide. And we know that the safety of this vaccine continues to be proven. Obviously, with vaccines, you may have some mild side effects, and those can be headache and fever, or even more serious, such as fainting, which can occur. But we also know that we want to dispel the myths around fertility as well, that obviously related to cervical cancer and et cetera, that the HPV vaccine helps protect women from future fertility problems. And it's a safe way to protect health and fertility, and that there is no evidence to suggest that the HPV vaccine causes fertility problems. So I want to briefly just touch on a couple of studies that have been published that have monitored the HPV vaccine since either 2006 or 2007. One of those, which I'm showing on this slide, is from Australia, and then the other one I'm going to talk about in a minute in the US. So this first study in Australia, where their HPV vaccine program has been monitored since 2007, and initially this program was rolled out for girls, but then in boys in 2013. And as you can see on this slide, you see substantial declines in the prevalence of HPV in those that are vaccinated versus those that are unvaccinated. And they've also seen substantial declines in high-grade cervical cancer disease and genital warts as well. Because of this program, Australia is in fact on track to eliminate cervical cancer by 2030. And I also want to point out that WHO now also has a large push as of 2019 to eliminate cervical cancer as well. And so again, HPV vaccination is cancer prevention, and cervical cancer highly correlated with HPV infection. And Australia is on track to eliminate cervical cancer, and hopefully the US will also follow suit as well. I want to talk a little bit about a study in the US that looked at vaccine effectiveness, and it was a 10-year study. And women that were vaccinated, or roughly 82% of the study, had significantly reduced risk of being infected with the other types of HPV, and this is when they were using the quadrivalent vaccine. And also, more and more women in the population were vaccinated, and thus those that were unvaccinated were also at decreased risk of being infected. And this is an indication, and again, they saw this in the Australia study as well, the indication of herd immunity. And so it's really important, I think, as Dr. Cohn mentioned out as well, for children to be vaccinated and for there to be the opportunity to provide that long-lasting herd immunity that will help the overall HPV infection rates drop. I just want to spend a little bit of time on this slide pointing out that HPV vaccination is long-lasting cancer prevention, and talking a little bit about some statistics that CDC has that indicate that in the different populations or the different age groups among teen girls, among young adult women, among vaccinated women, we see long-lasting protection, and we know that HPV types that cause HPV cancers and genital warts have dropped, and they've dropped 71% among teen girls, 61% among adult women, and then the percentage of cervical precancers that are caused by HPV types have dropped 40%. So those are some staggering results, and they are very, very positive with reductions in types of infections that cause cancer. So I want to talk a little bit about what you can do in your communities for helping increase HPV vaccination rates. And as said earlier, we know that everybody has best interest of their children at heart and best interest when it comes to vaccinating and taking care of their children. And so I want to talk a little bit about what you can do in your community. We have a Vaccines.GOV HPV partner toolkit that has promotional graphics, social media posts. There's some tools on there that are in English and Spanish, and so you can go to that site and use some of those tools to help promote HPV vaccination. You can also help spread the word on social media using an official hashtag, End HPV Cancers, and retweet HPV messages from the ASH or the Surgeon General. Both have been very active in helping us with our goal in the next 5 years to reach 80% of serious completion in adolescents. And they've been out tweeting about it, they've been out writing op-eds, they've been out talking to communities, presenting at conferences, and talking a lot about HPV vaccination and the importance in cancer prevention. Also, in April of 2019, nearly 3,000 Title X clinics offering HPV vaccine were added to the Vaccine Finder, which is on Vaccines.GOV. And it's an interactive tool that allows users to search for vaccination locations that offer all the vaccines that you see on this slide. And so this might be something helpful if you're looking for a location, if you live in a rural area and you just want to know who gives these vaccines. This might be a great opportunity for you to go to that site and take a look at where you might find certain vaccinations. August is National Immunization Awareness Month, and so we're really excited to be a part of this webinar, but we also want to talk to you about how you can raise awareness in your community. And as I just talked about, we have some social media challenges. We'd like for you to begin sharing tweets at HHS Vaccines or HHS or from the Surgeon General with all your followers. Get vaccinated and tell your community why you know it's important and that HPV is cancer prevention. HPV vaccination is cancer prevention. Show your support for immunization, share a story with your community, or educate your community on the cancer preventative benefits that we've talked about today with the HPV vaccine. And you might even consider hosting a vaccine event for your community. So I'm just going to close with, there are really 6 reasons that the CDC has on their website, and I took this from the CDC, to get HPV vaccine for your child. Like I said before, 80% of people will get an HPV infection in their lifetime. HPV is a common virus that infects men and women, and we recommend that you get vaccinated. HPV vaccination works. Infections with HPV types that cause HPV cancers drop 71% among teen girls, as I mentioned. HPV vaccination prevents cancer. We know we can prevent up to 30,000 cases of cancer each year with HPV vaccination. And obviously, preventing cancer is better than treating cancer. And your child can get the HPV vaccine when they get the other preteen vaccines, Tdap, and meninge. Preventing cancer is easier than ever before. So 2 doses, not 3 doses, unless they're 15 or above. And then if they turn 15, they'll need 3 doses. And 6 out of 10 parents are choosing to get the HPV vaccine for their children. So now that you know, now that we've talked about the fact that HPV vaccination is cancer prevention, and now that we've had the webinar today, and we know that HPV can lead to certain cancers, don't wait. Talk to your provider today about HPV vaccination, and certainly go out and talk in your communities about the preventative effects of HPV vaccination on cancer. Thank you.
All right, thank you so much, Drs. Beckham and Cohn. And now we are going to move into our question and answer session. Our first question is from Ashley. Ashley says that at this year's vaccine conference, participants were told that the HPV vaccine could be given starting at age 9. And she's asking if that's accurate or not. And then also we had a related question. Is the HPV vaccine effective for an adult? And just as a reminder, before I turn it over to Dr. Beckham to answer that question, please type in your questions either in the question and answer box or in the comment box. Thanks so much.
So yes, you can start at age 9. This is true, and it's effective in adults, and ACIP has just recommended up to the age 45.
Wonderful. Thank you so much, Dr. Cohn. Our next question is from Christine. Christine asks what to say to parents who are concerned that the aborted fetal tissue used to create certain vaccines, such as the rubella vaccine, hepatitis A vaccine, or the chickenpox vaccine, are present in those vaccines.
Amanda, you want to take that one, Dr. Cohn?
Yeah, I think I think that I don't. These were just to clarify. These were from cell lines that were developed many years ago, and in the current vaccines that are made, where there's no fetal tissue or aborted tissue is made, if that makes sense. This is the original vaccines may have been derived from those, but I think it's important to remind people that the vaccines that their children are receiving are completely not, don't have any of those types of ingredients in them. Great.
Thank you. Our next question is from Cynthia and Angela, and they ask what month is the recommended month to receive the flu shot, and then also what you can say to people who are skeptical about getting the flu shot.
Great. So the flu vaccine starts becoming available in July or August of every year. The recommendation, while you do want to get the vaccine, August, September, October are all great months to get the vaccine. Some people would say you should get it closer to flu season, so October may be the ideal month, but our recommendations are really to get it when it's convenient for you and when you have the ability to get it, because we're all really busy these days, and the most important thing is that you get it. So we recommend that you get it as soon as it's available in your doctor's office and it's available and it's convenient for you during that time period. What my favorite way of describing the flu vaccine, when you hear things like, oh, but I don't get the flu, or things like that, is to ask patients if they wear their seatbelt. And usually the answer is yes. And then you ask them if they've been in a serious car accident recently, and the answer is usually no. We hope we're not in a car accident, but we still wear our seatbelts to protect us from being injured if we are in a car accident. And I like to think of the flu shot in the exact same way as that.
Thank you. Our next question is from an anonymous attendee asking how we can combat misinformation regarding vaccines.
So this is Oh, do you want to start, Dr. Beckham? That would be awesome.
I'll let you start, and then I'll add if I have anything else.
Great. I think this is a really important issue that we've seen a lot about in the news today, and we really do acknowledge and see that misinformation. I think there's different types of information. I think there is some deliberate misinformation in the news today that is really confusing people and driving them to have more questions than they may otherwise have about vaccines. Then there's also just a lot of confusion and information that may not be deliberately inaccurate, but may not be as accurate as it could be. From HHS and CDC and MVPO, all of our groups are really working hard to try to get on top of this by getting the correct information out there as broadly and as widely as possible. And really working hard through social media platforms, as Dr. Beckham just talked about, in other ways to make information accessible and easy, and through webinars such as this, to try to just really counter all of the misinformation with an onslaught of accurate and good information about vaccines. Dr. Beckham, do you have anything to add?
No, I think you did a nice job. I think it's really important, and we're having this webinar today. Again, we encourage you all to get out and talk about the importance of vaccination, the safety of vaccines, and just talk to people who have those questions in your communities, and be those advocates. We know everybody, again, wants to do the right thing for their child's health, and everybody has opportunity to make those decisions based on their own beliefs, but we really encourage you all, as being on the webinar today, and hopefully we've been able to talk a little bit about some of the things, or some of the challenges, that you just get out and be champions of this, and point people to authoritative data sources, as Dr. Cohn mentioned, CDC or Vaccines.GOV, because we want people to go to those sites to get that correct information on those, and we feel that that's a great way. And again, just be advocates, get out there in your communities. I think it's a great idea to hold community sessions, to talk about it, and to listen. And I think Dr. Cohn mentioned earlier, just knowing that everybody wants to be heard and listened about their concerns. And so that's all I would add. Thank you.
Thank you. Our next question comes from Grace. Grace asks, what risks thimerosal pose in vaccines?
This is Amanda. I'll take that one. So thimerosal is a derivative of mercury, and mercury given in very high amounts can be toxic to neurodevelopment, to a child's brain development. That being said, there have actually been no studies to ever show that thimerosal was a risk, and certainly the tiny amounts of thimerosal that were in vaccines many, many years ago posed a neurodevelopmental risk. And in fact, I like to remind people that babies actually got a lot more exposure to mercury through breast milk than through, and continue to get exposure to mercury, but to amounts that are within reason. And everything can be toxic when given in high amounts, but the amounts that were of thimerosal, first of all, there were no studies ever showing that it was a risk. It was the connection with mercury, which we do know can be toxic when given in high amounts. And the important thing is that we took thimerosal out of vaccines many years ago because of concern about the risk, and I think that made people actually believe that there was a risk. But it was an abundance of caution, and all of our childhood vaccines are thimerosal free now.
I was on mute, so I will repeat that. Our next question is from Claudia. She was asking about if there was a website that participants could obtain information and educational slides to share with people for educational purposes. And I'll turn it over to the other two presenters momentarily to answer that question. But first, I'll just say that I will share all of the slides in this presentation in the follow-up email, and I'll send any pertinent links, anything that could be helpful to you guys. So does Dr. Beckham or Dr. Cohn have a recommendation for websites with educational resources?
I mean, they can go to, as I mentioned, Vaccines.gov, but the American Association of Pediatricians has some great information on their website, and then I know CDC, so I'll let Dr. Cohn talk to it.
Right. So in addition to those great websites, www.cdc.gov/vaccines/parents has really great parent resources, and partners tweeting out or sharing all of those links would be fabulous from our perspective.
Great. And we are at 1 o'clock, but we do have one more question. Our last question is from Susan. Susan asks if the presenters can talk about the safety of vaccines in children who have received organ transplants.
So I'll answer that question. I think that children who have received organ transplants are under highly specialized care, and there actually are special recommendations for vaccines for children based off of what type of organ transplant it is, and based on what immunosuppressive medications they may be on after those organ transplants. And so I would recommend that a parent of a child with organ transplants to talk to their doctors. But most importantly, those are the children in our communities that fortunately, to the miracles of medicine, are really thriving, and we need to continue to protect by vaccinating healthy children to make sure that these diseases don't spread to children who may be unable to get vaccinated because of medical illnesses.
Great. Thank you so much, Dr. Beckham and Dr. Cohn. And we want to thank each of our attendees for taking time out of their busy days. Please share your new knowledge broadly and keep in touch. As a note, we will be sending a link to the recording of today's webinar, as well as the slide decks, in the follow-up email to everyone who has registered. Also, be sure to register for our next mental health webinar on childhood trauma that will be held on September 4th. As well as our next family health webinar focusing on postpartum depression at the end of September, where we'll get a chance to hear from HHS experts on how to recognize the signs and symptoms of postpartum depression and what the faith community can do about it. Finally, if you're not on our mailing list and would like to be added, please send a note to partnerships@hhs.gov, and that's partnerships with an S on the end. And that is all for us today. Thank you for being with us, and we hope you have a good and fruitful rest of your day.